Okay, we're diving in. You know how we always talk about cutting through the noise and getting to the core of complex information. Today, we've got a deep dive into a situation where the science, actually commissioned by the state itself, seems to be pointing in one direction, while the policy is, well, firmly headed in another.
That's right. We're exploring a specific case in Utah regarding gender-affirming care for minors. What's fascinating here, according to our sources, is this really clear disconnect between the findings of a major scientific review, which the state legislature actually requested, and the political stance that's currently impacting healthcare access.
Okay, let's unpack this then. Our stack of sources includes excerpts from the detailed report by the University of Utah College of Pharmacy, on gender-affirming medical treatments for pediatric gender dysphoria.
Mm-hmm.
We also have documents from the Utah legislature outlining the requirements for this report and the law that mandated it, plus some news analysis, including an article from Mother Jones that covers the political response to the study.
So our mission today is basically to walk you through what the significant scientific review actually concluded based on the available evidence. Understand the recommendations that came out of it, and then look at the political context and response as described in our sources.
Right. We'll highlight where the science and the policy seem to diverge and maybe explore what that disconnect means for how laws get made, especially around healthcare.
Exactly.
So, where does this story begin?
Well, our sources trace it back to Utah Senate Bill 16, which became law in January 2023. This bill did a couple of key things. Crucially, for our deep dive, it established a moratorium.
Like a temporary ban?
Essentially, yes, a temporary ban on initiating hormonal transgender treatments for minors diagnosed with gender dysphoria.
Okay.
Correct. And as part of that same law, SB 16, the Utah Department of Health and Human Services, or DHHS, was required to commission a systematic medical evidence review of these treatments.
Required by the law itself.
Yes. The stated purpose, right there in the law, was to give the legislature recommendations they could use when deciding whether to lift that moratorium. So, the political body explicitly asked the scientific community for guidance based on the evidence.
Got it. Okay. And who are the scientists tasked with this? Who actually did the work?
The DHHS contracted with a group with specific expertise in pulling together and analyzing large bodies of research. The University of Utah College of Pharmacy's Drug Regimen Review Center, the DRRC.
The DRRC. All right.
Their job was to conduct a really comprehensive analysis of these treatments, looking at everything from effects and side effects to long-term impacts. How often people desist or regret treatment, the quality of the evidence, and importantly, the risks and benefits of treating versus not treating.
And how extensive was their search for evidence? Was it like just a few studies?
No, not at all. And this is where the report kind of pushes back against that common idea that there's limited data on this topic. The DRRC conducted an incredibly thorough search. They found hundreds of relevant studies in their initial sweep. Far more evidence than many expected or than previous systematic reviews had located.
Hundreds. Wow.
Yeah. They focused their deep analysis on nearly 90 high-priority clinical studies published in English, representing outcomes for over 28,000 pediatric patients worldwide who had received care for gender dysphoria.
Okay. 28,000 patients globally. That's a significant body of work. And the sources mentioned they specifically dug into long-term outcomes as well.
Yes, that was a specific request from the advisors consulted by DHHS. For a later part of the report, they looked at studies reporting data for patients with at least 5 years of exposure to hormonal treatments or hormone blockers.
5 years or more.
Right. They found dozens of these long-term studies, ultimately extracting data from 15 that met their criteria, which allowed them to examine outcomes like mortality over longer periods.
All right, so the DRRC team completed their exhaustive review. After spending months digging through all this data, what were their core conclusions? This is where, as they put it in the report, it became impossible to avoid drawing some high-level conclusions. What was the big takeaway?
Well, their expert opinion, stated directly in the report, is that the consensus of the evidence they reviewed supports that these treatments are effective and generally safe for pediatric patients experiencing gender dysphoria.
Okay, effective and safe. Effective in what ways, specifically?
The report highlights effectiveness in improving mental health and psychosocial outcomes, and also in helping patients achieve body changes consistent with their affirmed gender.
And what about safety? Define generally safe.
They found the treatments to be generally safe for short to medium-term outcomes. The report notes minimal patient-level changes in things like bone density, cardiovascular risk factors, metabolic markers.
So no major red flags there in the medium term.
Well, any changes they observed kept the average patient's values within the normal range for their affirmed gender. For example, they mentioned transgender women's bone density levels might be lower than their potential had they not transitioned, but the report states they typically remain within the normal range for healthy cisgender women.
Okay, that makes sense. Did the report look at whether these findings align with, the broader medical consensus, guidelines and such?
Yes, absolutely. They reviewed guidelines from recognized medical authorities. These guidelines, based on their own systematic reviews of the literature, generally support the use of puberty-suppressing drugs in early puberty and cross-sex hormones for older adolescents. The consensus of these guidelines does acknowledge the medical validity of treating pediatric patients with hormonal therapy after puberty begins.
Right. And one big concern often raised in discussions about this care is future regret. Did the report address that?
They did, yeah. Specifically looking at studies that tracked this. Based on the evidence they found, the report concludes there is virtually no regret associated with receiving these specific treatments.
Virtually no regret, even among those who stop.
Right. Even among the small percentage of patients who discontinued treatment, changing their mind about their gender identity was found to be a very minor reason overall. The reasons for discontinuation were varied, not primarily regret.
Interesting. And they compared their findings to other systematic reviews out there. How did their work stack up?
Yes, they looked at dozens of other systematic reviews that had been published. Most of these reviews, according to the report, supported the conclusion that gender-affirming hormone therapy for pediatric patients with gender dysphoria is generally effective for mental health and body changes, and generally safe for physical health outcomes like cardiovascular or bone health.
Most supported it. Were there any that didn't?
They did note one outlier review that concluded the treatments were experimental. But they pointed out that review excluded a significant portion of eligible studies, which, goes against standard best practices for systematic reviews.
Ah, okay. So methodological issues with the outlier. And stepping back, was the DRRC's review more comprehensive than these others they looked at?
That's what the report indicates, yes. They emphasize finding hundreds of studies and extracting data from nearly 90 high-priority ones, stating this was a more extensive search than any of the systematic reviews they noted, the largest of which found only 36 studies in their own search.
So, significantly more comprehensive. Let's touch on those long-term outcomes again, particularly the mortality data. That sounded like a serious concern earlier.
It does sound concerning, and it's important to be precise here. The long-term studies did show overall positive mental health outcomes. For mortality, they observed increased risks in both transgender men and women treated with hormonal therapy compared to the general population, with the risk being higher in transgender women.
Okay, increased risk compared to the general population. But what was causing that increased risk? Was it the hormones?
That's the crucial part. The report states these increased mortality risks were consistently due to factors like suicide, non-natural causes, and HIV/AIDS. Not directly attributed to the hormonal treatments themselves in terms of things like cardiovascular events or cancers, except for maybe a slight increase in specific types of benign brain tumors.
So the increased mortality wasn't necessarily from the hormones themselves, but related to other, often psychosocial factors. And there was a key detail in the source about when patients received care in relation to this.
Yes. This is a really critical finding highlighted in the long-term studies. Patients who were seen at a gender clinic before the age of 18 actually had a lower risk of suicide compared to those who access care as adults.
Wow. Lower risk if they got care earlier as minors. That seems significant. What about FDA approval for these treatments in minors? Is that covered?
Yes, it is. The report confirms that none of the specific hormonal treatments reviewed have dedicated FDA approval specifically for treating gender dysphoria in minors or adults.
Okay, so no specific FDA approval.
Correct. However, it explicitly states that using these medications off-label for gender dysphoria is common medical practice and is considered the standard of care. The report also puts this into context, noting that off-label use of medications is generally very common in children, for lots of conditions, with rates as high as 79% of children receiving off-label prescriptions for various things.
So off-label use in kids is common practice anyway?
Very common. And the report also touched on the concept of desistance.
Right. What did they say about that?
Just that it noted the definition of desistance is actually quite unclear and varies widely across the literature. with different interpretations ranging from, say, the disappearance of gender dysphoria symptoms to a change in gender identity over time. Not a clear-cut concept in the research.
Okay, so bringing all these findings together, the effectiveness, the safety profile, the low regret rates, the sheer extent of the evidence they found, the nuance on mortality, the standard practice of off-label use, the support in medical guidelines. What was the final expert opinion stated in the DRRC report based on all this evidence?
Here's the direct quote from their report, their bottom line. Based on the reviewed evidence included in this report, it is our expert opinion that policies to prevent access to and use of GAHD gender-affirming hormone therapy for treatment of GD gender dysphoria in pediatric patients cannot be justified based on the quantity or quality of medical science findings or concerns about potential regret in the future, and that high-quality guidelines are available to guide qualified providers in treating pediatric patients who meet diagnostic criteria.
Cannot be justified based on the science. That's a very strong conclusion from the state's own commissioned review.
It is.
So, the scientific report explicitly concludes that policies preventing access aren't justified by evidence. Now, the DHHS report, which included these DRRC findings, also provided recommendations. But they made it clear these were steps to take if the legislature decides to lift the moratorium, right? What were those recommendations for ensuring high-quality care?
Exactly. The DHHS report states it doesn't take a position on whether to lift the moratorium, but if the legislature chooses to, they recommend several things based on the evidence reviewed and, best practices observed in effective care models.
Okay. What's the first recommendation?
They suggest considering the creation of a hormonal transgender treatment board, or HTTB, overseen by DHHS. This board would be responsible for advising on certifying providers, setting minimum standards of care, ensuring continuing education, and establishing consent procedures.
Like an oversight board.
Pretty much. The sources note the legislature already has some certification requirements in place, and this board could enhance those, maybe create a registry of certified providers. The board could also keep reviewing new evidence and update recommendations over time. Keep things current.
Okay, setting up expert oversight if care resumes. What else do they recommend?
Limit who can provide this care to demonstrated experts. The DHHS report recommends that, at least initially, prescribing hormonal treatments for minors be limited to Utah-licensed physicians who have gone through the state's certification program.
Limiting it to certified doctors.
Yes. And they also suggest a process to audit credentials and treatment records to ensure compliance with standards, quality control.
So expertise is key. Makes sense. And the third recommendation?
Require care to be delivered through a comprehensive interdisciplinary care team model.
Interdisciplinary, meaning?
Meaning a team approach. This type of model integrates both physical and mental health care professionals, uses evidence-based protocols, tracks outcomes, and reports back regularly to the legislature. DHHS suggests every 2 years.
Okay.
And the report emphasizes that the positive long-term outcomes found in the scientific review, like that lower suicide risk for those treated earlier, those came from studies where patients received care within these integrated team-based models. You can't just assume those results would happen in other settings, like with a single provider working alone.
Right. The team approach seems crucial for the positive outcomes seen in the studies. Integrated, team-based care is essential. And the fourth recommendation?
Institute an enhanced and very clear informed consent and assent process. Because hormonal treatments can lead to irreversible physical changes, the report stresses that this decision process needs to involve the interdisciplinary team, take sufficient time, and thoroughly cover all potential physical, psychological, and social risks, benefits, and alternative options. No rushing it.
Okay, thorough consent. Can you clarify the difference between consent and assent in this context? You mentioned both.
Certainly. Informed consent is the legal guardian giving their permission after being fully informed about the care. Standard legal consent. Assent is for the minor themselves. It's about respecting their developing capacity by helping them understand their condition and the proposed treatment at a level appropriate for their age and development, and involving them in the decision-making process to the greatest extent possible.
So involving the young person in the decision.
Exactly. The report notes that simply looking at age isn't sufficient. A child's individual ability to understand is important. They also stress that the mental health component of care shouldn't just be focused narrowly on getting access to hormones, but on assessing and treating gender dysphoria through therapies that can help alleviate distress and facilitate adjustment, whether or not hormonal treatment is ultimately pursued.
Right, holistic care.
And the proposed HTTB could help develop standardized consent materials and guidelines for who is qualified to conduct the assent procedures.
Okay, so to recap, we have this detailed, extensive scientific review commissioned by the state's own legislature concluding that policies blocking access to care for minors with gender dysphoria are not justified by the evidence. And we have recommendations from DHHS based on that very report for ensuring high-quality, safe care if the moratorium is lifted. Given all this, what has been the political response described in our sources? This is the key disconnect.
This is absolutely where the core disconnect becomes very apparent based on the news reports we have. The very legislators who commissioned this study are reportedly dismissing its findings and stating their intention to keep the moratorium in place.
Wait, they're dismissing the findings of the study they asked for.
Yeah.
Sidelining it.
That's what the sources indicate, yeah. The Mother Dunn's article, for instance, quotes State Representatives Katie Hall and Bridger Bolander, key figures in the relevant committees, explicitly stating, we intend to keep the moratorium in place.
Wow. And how are they justifying this, according to the sources? How do they explain ignoring their own commissioned report?
Well, the sources report that they are citing public polling and questioning the strength of the scientific evidence. Hall and Bolander's statement in Mother Jones says, Utah was right to lead on this issue, and the public agrees polls show clear majority support both statewide and nationally.
So they're pointing to polls.
Polls, and they add, simply put, the science isn't there, the risks are real, and the public is with us.
Okay, hold on. The science isn't there. Despite the DRRC report finding extensive evidence, concluding the treatments are effective and generally safe, and stating explicitly that policies preventing access are not justified by the evidence, they're still saying the science isn't there.
That is precisely the tension highlighted in our sources. That's the disconnect. The Utah Science versus Politics summary document we looked at explicitly characterizes the political climate as one marked by a suspicion of medical consensus, where lawmakers are questioning the validity of the rigorous report they requested and citing a lack of high-quality evidence.
Even though the report found more evidence than usual?
Right. Even though, as the DRRC report details, they found far more evidence than many previous reviews and concluded the treatments are generally safe and effective based on that evidence.
And they appear to be prioritizing public opinion polls over the detailed scientific findings of the state's own commissioned review.
The summary document connects this explicitly, describing it as part of an ideologically driven restriction that aligns with national political trends, often using talking points about desistance, regret, and harm that, according to the DRRC's comprehensive review, are not substantiated by the evidence they found.
So the sources really frame the situation as the state's best available evidence, generated by its own institutions at the legislature's request, being basically set aside in favor of maintaining an existing policy based on other factors, public opinion, political ideology.
Exactly. That's the picture painted by the sources. The DRRC report represents a scientific consensus drawn from a vast body of research, concluding that care is beneficial and safe for many young people experiencing gender dysphoria, and that denying access isn't justified by the evidence. The political response, as described in the sources, appears motivated by a different set of priorities, effectively sidestepping those scientific conclusions.
This deep dive into the Utah report and the political response really highlights a pretty stark difference, a gulf, between what the science found, according to this extensive review, and the policy decisions currently in place.
It certainly raises important questions, doesn't it, about how scientific evidence is or maybe isn't used in the political process, especially when dealing with complex and sensitive medical issues like this.
So what does this all mean for you, the listener? I think it underscores the importance of looking critically at the sources that inform public policy, understanding the difference between scientific conclusions drawn from rigorous evidence and political positions that might be influenced by other factors, whether that's public opinion, ideology, or something else. It's just crucial in navigating today's information landscape.
And it leaves us with a significant question to consider, maybe for your own reflections. In a democratic society, how should the findings of rigorous state-commissioned scientific reviews weigh against public opinion and political stances when shaping laws that directly impact healthcare access?
Yeah. How should that balance work? Something to ponder for your own deep dives.
Yeah.
Thanks for exploring this with us.